Hello, this is Dr. David Green, CEO of the California Pain Network. Today's topic is my hip pain coming from a hip or a lumbar spine problem? Millions of Americans suffer from hip arthritis. The pain may cause significant disability and limited ability to walk, to exercise. Close to 300,000 total hip replacements are performed every year in the U.S., and this number keeps rising every year with the baby boomers and the amount of people who are undergoing this procedure. When the pain is occurring in the hip area, it just seems naturally obvious to assume the problem is occurring from the joint itself. However, it may not actually be coming from the hip. Okay, there may be an overlap in symptoms between hip arthritis and what's known as lumbar spinal stenosis. As individuals age, spinal stenosis is extremely common, just as hip arthritis is, and both occur from degeneration. All right. Lumbar spinal stenosis occurs with degeneration of the intervertebral disc, which then leads to arthritis in the spinal joints, which then leads to bony and soft tissue overgrowth, and that can start pinching spinal nerve roots as they try to get off from the spinal cord, and it can lead to buttock pain, leg pain, hip pain. So the pain in the hip may mimic arthritis pain. So how to differentiate between the two? Well, it may not be so easy. Here, what you see is degeneration of the lumbar spine, a lot of disc bulging here, okay? And then this is a joint back here that's overgrown. So you have disc bulging, you have arthritis overgrowth. That can really pinch the nerve roots as they try and get out, okay? And here you see that as you get older, it's not just disc bulging, it actually can be bony overgrowth. This is looking at it from the side. All right, so an arthritic hip, you start to get loss of joint space. You have a decent joint space here. And then you have some cyst formation, extra bone formation. So that can be an extremely painful. Now, how do you differentiate between whether it's a hip problem or a lumbar spinal stenosis problem? Well, some of that can come from the history. If a person says they have pain right over their hip joint, you know, it may be indicative. Duration, when does it come, when does it go? Both of these can cause referred pain down the legs. That's not always a differentiating factor. Physical exam, if they have point tenderness right over the hip, that's often indicative of arthritis. Range of motion pain, if you do a range of motion of the hip and that is really painful, that's more indicative of arthritis pain. Neurologic exam, that doesn't really help. Imaging studies can also be helpful. This is a cross-section of a spine that has a lot of spinal stenosis. Normally this is circular. With all the arthritis, you have a triangular format. And then here you have overgrowth of arthritis and difficulty with these nerve roots getting out. So an MRI really is a study of choice when looking at the lumbar spine. Diagnostic injection can be the best way. It's more the gold standard. So if you have an injection into the hip, and this should be done under fluoroscopy, which is real-time x-ray, it goes right into the hip. If it decreases the pain within minutes, then you can pretty much say the hip joint is causing the problem. Okay? You have arthritis, you put an injection right into the hip joint of numbing medicine, the pain went away pretty quickly, there you go. All right? But if it doesn't work, or if it only takes away part of the pain, then an epidural injection can be very helpful in the areas of where the suspected spinal stenosis is. All right? So if you do an epidural injection, the person says pretty quickly, that did it, my pain is gone, then the numbing medicine probably kicked in, and you can say, okay, it's an epidural, it says lumbar spinal stenosis problem. All right? Now, if you get complete hip relief with a hip injection, it's a hip problem. If you get complete hip relief with an epidural injection, it's most likely a lumbar problem. If you get some relief from the hip injection with the rest of relief from an epidural injection, you most likely have a combination of the two. Okay? And then there's always the possibility that neither injection will work well. In that case, it still remains a conundrum and further investigation is necessary. So there you go. The top California pain treatment centers are affiliated with the California Pain Network. There are over 50 insurances being accepted. The clinics are all through the state, including San Diego, through Orange County, LA, Inland Empire, up through to San Francisco and Sacramento. Over 90% success rates overall. and their doctors are board certified and award winning. So visit us on the web at californiapainnetwork.com and then call us at 877-877-8556. I'm Dr. David Green with the California Pain Network. Your pain stops here.